Welcome, everyone. Good morning. Thank you all so much for joining today. My name is Courtney Downs. I'm with Kentucky Youth Advocates and the Kosair for Kids Face It movement. And again, just thank you all for joining us today. I know we sent out these calendar invites and I had put an hour, but we're only going to need probably about 30 minutes this morning just to get to everything. So feel free to use the chat throughout for comments, for questions. We'll also pause periodically just to check in with folks, see if there are any questions or if there's anything that needs to be clarified also. So let's go ahead and jump in. Just a little bit of background before we get started, just on the Face It movement. So Face It is an initiative that is founded and funded by Kosair for Kids. It launched in 2013, and that was in response to the public outcry against the number of child abuse related fatalities that we were seeing across Kentucky at the time. And our goal with Face It is to prevent and to end child abuse and neglect through the promotion of best practices, by building community awareness and engagement and connection, especially among parents and caregivers and families. And then also advocating for policies that support parents and caregivers and also keep kids safe. So what started as a group of about 10 stakeholders has since grown to more than 200 partners across the state who represent a wide array of professions and who are all committed to ending child abuse in Kentucky. So our goals for today are really basically our goal for the information session is to share tangible tips, strategies for participating in and promoting 10-4 Day in 2026. So at the end of this session, we want you all to know more about the 10-4-FACESp Bruising Rule, about 10-4 Day, about some local partners, but then also some national stakeholders, advocacy efforts over the past few years. And we really just want people to leave here feeling equipped with key information to get involved and to help raise awareness. So I'm going to give you all just a brief history of 10-4 Day. So in 2019, Dr. Shannon Moody, who is the executive director at Kentucky Youth Advocates now, she was attending a training about child abuse that included information about the 10-4-FACESp Bruising Rule when she had this idea to create an awareness campaign about 10-4 on 10-4 or October 4th. So 10-4 Day officially launched in Kentucky that October and has since just become an annual campaign for us. So it's an opportunity to educate and to build awareness, not only of the bruising rule, but also of the importance of recognizing and preventing child abuse. And since 2019, our statewide partners have helped to secure proclamations from Kentucky's governor, the attorney general, mayors, and dozens of other local leaders like county judge executives. And then also through our partnership with Lurie Children's Hospital in Chicago, as well as Mass General Brigham in Boston, we have been able to expand the 10-4 Day advocacy efforts nationally, which is really exciting. To date, I want to say there have been about 20 other states, maybe a little bit more in U.S. territories, who have recognized 10-4 Day in a variety of ways. So we've seen folks who have hosted lectures, conferences, grand rounds, they've published op-eds. We've seen people sit for interviews with their local media, post on social media, host press conferences. Folks have been able to develop or adapt take-home resources for various professionals. And we've even seen some national partners have also been able to establish like assessment processes and protocols, both within hospitals and within child welfare agencies. So really, there's just a lot of amazing and really exciting work that's been able to go on all under the umbrella of 10-4 Day. All right, so next, I'm going to talk a little bit about what 10-4 is and how to raise awareness. So very quickly, for those who aren't familiar, the 10-4-FACESp Bruising Rule is a clinical decision rule. It was developed and validated by Dr. Mary Clyde Pierce and some of her colleagues out of Lurie Children's Hospital in Chicago. And this is just a useful acronym for those who, it's a useful acronym to help screen children with bruises who are under the age of 4, or for any child who is not yet cruising or pulling up, to identify when a bruise is more likely to be caused by abuse than by an accidental injury. So when you think about like young kids and infants, we know they fall, they're going to get scrapes and bruises, but it's almost always going to be on some of the bonier parts of the body, right? Or like the more prominent parts of the body. So it's going to be like the elbows, the knees, the shins. It is far less likely for a child to fall and bruise a part of their torso, especially like the softer part of the belly or anywhere that isn't covering bone. Their ear, which can typically be an indication of, sometimes can indicate like pinching, pulling, or some other type of head trauma, or to the neck. So that's what the TEN stands for, is torso, ears, and neck. And then for faces, the F is frenulum, which is the kind of fleshy part that connects your lips to your gums. The angle of the jaw, which is A, so it's kind of this part right here, which is like the fleshy kind of underneath part of your jaw. Obviously, the cheeks, the eyelids, and I can never say this word correctly, the subconjunctivae, I think is how you say it. It's the whites of the eyes. That's what it is. So, and then P is for pattern bruising, right? So that could be anything from a handprint to, belt, extension cord, any other number of objects. Are there any, I know that's a lot of information. Are there any questions?
I do have a question. Um, so the the age thing.
Mhm.
So for children 4 and under, this applies. Why does it not apply to older children, especially like the patterned bruising?
So this, and I know we have a doctor on here, and I don't want to put you on the spot necessarily. Do you have a?
Sure. So no, pattern bruising, I would say is highly concerning for inflicted injury, no matter the age of the child. It's just when you're looking at the age of the child, you're also taking into account how well they can communicate. So there could be a 16-year-old or a 9-year-old who has a pattern bruising, who has a pattern bruise. And if they're able to tell you a history that makes sense, because none of these things are pathognomonic or diagnostic of abuse, there are accidental ways that some of these injuries could happen. And so, really, a lot of it depends on how well the child can communicate to tell you what has happened. Now, if you have an
So
older child who can't communicate,
that's it.
then that can also increase your concern as well. Then I look more into the mobility of the child. If you have a 16-year-old who has significant cerebral palsy and is not mobile at all, and their caregiver is struggling to get them in and out of the bath, then sometimes, there may be an accident or something that causes a bruise in a place that we're not typically seeing bruises, but because of the child's size and the difficulties with mobility, then, you can have some sort of bruising if there's been an accidental injury that you might not expect in a child, say a 2-year-old with those same difficulties and impairments. So, I mean, really, you have to take into account each child, and this is really a suggestion to help with the younger children who can't communicate. But yes, if you have an older child with pattern bruising, I would hope they'd be able to tell you what had happened. If they can't tell you what happened, then I would be concerned as well. And we may need some more investigation to try to figure out exactly what it is. But with all injuries, we need to be evaluating the history that's provided to see if that could account for the injuries that the child has sustained.
So I'll share an experience real fast. I have a medium-aged child with Down syndrome who has difficulty communicating. And he came home with a handprint patterned bruising on him. And once it got to CPS here locally, they were very dismissive of it because, well, kids with special needs just get bruises. Yeah. And whenever I brought up the 10-4-FACESp Bruising Rule, they told me, well, that only applies to kids 4 and under. So I feel like it's incredibly important to, while this is a great resource, it forgets about the older kids who don't have that ability to communicate what is happening. And I mean, they literally told me, well, that only applies to kids 4 and under. And he was 9 at the time. And it just kind of, I was like, well, I don't know how to respond to that because it does apply to kids 4 and under, per the training. And so I just feel like it would be beneficial to somehow include those kiddos who may be older that don't have that ability to communicate.
And I would say that's a misuse
Oh, without a
of
doubt.
this rule. There is plenty of research that shows patterned injuries, no matter the age of the child, are concerning for inflicted injury. So I would say that's a complete misuse of this tool on the part of DCS, because this tool is really geared more towards the 4 and under, but that doesn't mean, like you're saying, that doesn't mean that these things only apply to children younger than 4. So I hear exactly what you're saying. And yeah, to have some caveats or, an additional sort of addendum could be helpful, but also I think that's when it may be helpful to get a local child abuse pediatrician involved
There
to
was.
Oh, okay, okay.
They diagnosed it
Because
as non-accidental trauma. CPS still dismissed it.
okay.
Sorry. I just,
No,
I, my little guy doesn't have, he's verbal some, but he doesn't have voice to advocate for himself,
sure.
along with a lot of kids with disabilities. Um, and somebody has to be their voice.
Agreed.
Um, so yeah.
And I thank you, Dr. Wade, too, for jumping in to answer that, and Jessica for sharing that experience. So there's just a couple of things I'll say. At least I want to say maybe last year, as we were promoting 10-4 Day, one of the things that we also started to do is talk about, not only is it an opportunity to raise awareness about the bruising rule, but also the critical importance of recognizing, responding appropriately, and then reporting abuse, period. So that's like regardless of age. And then I can also, maybe if I have your contact information or just in the chat in a minute, I can talk to you a little bit more about some of the child abuse prevention work that we've been doing that's specifically targeted towards kids with disabilities. We have like a work group that just focuses on that. So I can give you some more information on some ways that we've been kind of engaging in that work as well.
Yeah, that would be awesome. So I sit on Kentucky Seat, which is a council that,
Right. Yes, I'm
yeah, yeah.
familiar. Yeah.
And then I also work for Kentucky Family to Family Health Information Center. So it's it's under the Office of Children with Special Healthcare Needs.
Okay.
And I think it's incredibly important to voice the I don't know the term, but I just had a brain fart. I haven't finished my coffee this morning. Um, but how likely our kids are to, or how much more likely they are to being exposed to abuse.
Right.
We know that they are not only one of the most represented populations, but also one of the most underrepresented populations as well.
Mhm. Right.
And so whenever I see information that's talking about abuse that does not include our kids with special needs specifically, because people tend to like forget about them and think, oh, kids with special needs get bruises. I just always kind of voice that.
Yeah, no, I appreciate you for speaking up on that, and for being here today. So, okay, I'll follow up with you on some of that. So, moving on then to, I think, what's the next slide, Clarissa? All right. So, a part of raising awareness about 10-4 day, about bruising rule, is really just balancing the need for recognizing and reporting abuse with opportunities to positively engage with and support parents and caregivers to bolster that connection as a way of preventing the child abuse from ever occurring in the first place. And some of the strategies that we have listed here are just ways that we have been trying to strike that balance over the last 5 years, and we'll kind of get into each of them a little bit more in detail. So we, leverage the media and social media, kind of building awareness with decision makers through these proclamations. Our trainings offer tangible tools and information for those who work with or who interact with families. We encourage our community-based partners to host positive parenting events to engage and bolster connections among parents and caregivers. We offer a variety of free resources online and in print that can be requested on our website and shipped anywhere in the state for free in any quantity. And then we also focus a lot on the multi and interdisciplinary collaboration. And with that, we want to make sure, you can go to the next slide, Clarissa. We want to make sure that, experts are a part of the conversation, obviously. Doctors and nurses, researchers, advocates, but we also want to encourage engagement with people who may interact with children frequently, but aren't necessarily serving kids in a professional capacity. So we know that each of us has a really critical role to play in prevention. And so having a team and collaborating in your communities is critical and effective in getting people to take action around 10-4 day and then also in broader child abuse prevention. So I am going to now hand it over to Clarissa, who's going to talk some more about some of the other awareness activities.
Hi, I'm Clarissa. I'm on the external affairs team at Kentucky Youth Advocates, and I do the social media and marketing for the Kosair for Kids Face It movement. So I'm just going to talk to you today about leveraging media and social media so that you can spread awareness around 10-4 day. And so this is a key component in raising awareness to connect people throughout the state, and then because we have people not in Kentucky on here, also throughout the nation about the 10-4-FACESp Bruising Rule. And we do this in a number of ways. And one of those is by working with our media partners. We've hosted press conferences before. We've for reporters to hear directly from experts about the importance of the day. There are several counties and cities in Kentucky that also host press conferences, or they host a signing or a proclamation awareness at their city council meetings or town meetings. Social media is an obvious tool for promoting the 10-4-FACESp resources and messaging, as well as sharing about the trainings and other events happening around 10-4 day. We also offer, like we do every year, we offer a social media toolkit on our website. I'll drop the link in the chat. It's on our faceabuse.org/10-4. And it is for community partners to share graphics. We have sample posts, things that you can share on your social media profiles to raise awareness about the rule, ways that parents can support, themselves. They can also, care for themselves while caring for their children. And then infos about the trainings if that's something that, you guys want to share. I know some people share the training graphics, but some people share the general rule. The toolkit has everything that you need and language so you can choose what works best for your social platforms. We encourage you to share posts directly from our social media profiles. If you also want to do that, if you don't have a dedicated comms person, you can just reshare our posts. If you have funds, boosting your posts on Facebook and Instagram can help to target the messaging even further. You can direct that at professionals who work with young children and families. Other ideas for spreading the word, sending an email blast to your partners and professionals, hanging around flyers in your offices or your place of work to promote 10-4 Day and the trainings, passing out brochures. We have the 10-4-FACEsp. We have free materials that you can order on our website. You can request entities like local hospital systems, health departments, universities, professional associations like the Dental Association or Nurses Association to share information on their social platforms and in their networks, as well as contacting your local leaders who are can enact these proclamations. And in the toolkit that you can get to from our website, there is a proclamation request letter explaining what 10-4 Day is, as well as a template that you can use, which is kind of noted on here. And you can send that to your local official. They can just fill in the blanks, and there you have it. And that's a really great way to garner attention statewide and in local communities. And that's an official proclamation of 10-4 is October Day. So, or October is 10-4 Day. So you can see some samples of previous proclamations from the governor, from mayors, judge executives of different places. We've successfully secured proclamations from the governor and attorney general, as well as several mayors and county judge executives with the support of our community partners. We've made requests for the governor AG in major cities like Louisville and Lexington, like ourselves, but we do rely heavily on our partners to help us make these requests as the nonprofit leaders in your own communities. And so if you are interested in supporting us in securing local proclamations for your jurisdiction, you can use the toolkit, like I've said before, and utilize the template letter that explains it and the request. There's a spreadsheet also for partners. You can sign up to request a proclamation. If you'd like, you can also email us too and just let us know if you're requesting a proclamation in your area. And we will note that so we can make sure, there's not, 7 orgs in Lexington requesting a proclamation, things just like that. So let's see. Any questions? Okay. Next
Teresa,
one.
where would do you have the link for that spreadsheet?
Yes, I can put it in the chat when I'm
Yeah, when you're not
go.
presenting.
Yeah,
Sure.
I only have one screen, so I'm not sure. Yeah.
No worries.
But yeah, we can, and Courtney might have it, but I'm not
Yes,
sure.
I will. I'm sorry. I
Oh,
can share it now.
it's okay. Yeah, I just didn't know. Yeah, you can check it out and see. There's a lot of places we have on there, but okay.
All right.
Training. Oh, sorry. This Courtney, this is you.
No, I was gonna say,
Yeah.
you can take it if you want to. Each year, so every year we host, like really just host like a week of child abuse prevention related trainings that include information on the 10-4-FACESp Bruising Rule, abusive head trauma, and then also safe sleep. This year we are going to be hosting trainings that are open to everyone on Tuesday, October 6th, and then also Thursday, October 8th. We always encourage folks to attend if possible, just to learn more, not only about the bruising rule, but just other general indications of potential abuse, as well as ways to intervene and strategies to prevent. One of the things that we also consistently do is we make sure that we secure CEUs for a variety of professions. We recognize the importance of being able to offer these CEUs for free and do so as often as we can. There are also some professions that are actually required by law to receive either one-time or recurring training on whether it's pediatric abusive head trauma or some other type of child abuse prevention or recognition related education just to maintain their licensure. So if you have not ever had the lovely experience of trying to secure CEUs by professions, just know that it can take some time for certain professions. It could take up to 3 months just to get approved. So start with that process as early as possible. And we have found that a really good first step is usually to reach out to a specific accrediting body who offers the CEUs to just kind of begin the process or just to understand what the requirements are for the process. And then, when scheduling trainings, obviously think about your target audience and the best time of day to reach them. Think about whether in person or online or, some combination of both works better. We have also had a lot of success with being able to co-host some of these trainings. So this year we are actually co-hosting 2 trainings with HANDS, the home visiting program. So they have about 400-ish folks on their staff. And so we're offering 2 trainings for them to get a lot, if not all of their frontline staff trained. So I will also share the links to register for that training as well. And then I will pass it back to Clarissa to introduce our partner who's going to speak.
Awesome. And I'm going to drop in that you can register for the trainings at faceitabuse.org/10-4 rule. That's the webpage that you can find all of this information on, including registrations. I just am unable to copy and paste at the moment. So without further ado, I'm very excited and very grateful to introduce Dr. Erin Wade, who is a child abuse pediatrician at Le Bonheur Children's Hospital in Tennessee, so that she can share how they've observed 10-4 Day and how it has impacted their community.
So hi, I'm Erin. I did my pediatric residency training in Louisville. So I actually was a part of the Face It meetings for a couple of years and am constantly in awe of everything that y'all do for the kids. So that's wonderful. I'm so proud to have been a part of that in the smallest way. But 10-4 is something that's really close to my heart whenever I have residents or students rotate with me. I always say, if you take away one thing, I hope it's the 10-4-FACESp rule. So I was really excited to bring 10-4 Day to Le Bonheur here in Memphis. I started it in 2024 and I created our first 10-4 Day conference. So we had speakers speaking about 10-4, FACESp about the bruising rule. We had talks on abusive head trauma. We had some talks on our child advocacy center, just so that providers and other people within the community could understand the workings of the Child Advocacy Center and how they help children so much in our area. The city of Memphis Mayor Young, signed a proclamation that year, and then I did that month's podcast for our children's hospital focusing on 10-4-FACESp. The following year, 2025, Mayor Young, the Memphis mayor, again signed a proclamation, and then we also were able to get the governor of Tennessee to sign a proclamation, which was very exciting. Then the Tennessee Commission on Children and Youth interviewed me and posted little snippets of these interviews on social media, on their website. And our Le Bonheur Hospital marketing team also helped promote 10-4 through their blog, their social media, website, that sort of thing. And then one of the projects that I became most excited about, and I'm still very excited about, is oh, and sorry, I forgot that I had all of these other slides. So this was just our 10-4 Day conference. This was our schedule. It was very exciting to be able to have this and have this for our community to be able to attend. And next slide. So this was the podcast, Peds Pod, that I did in 2024. And next slide. And all of our podcasts are archived, so anyone can see them or go back to them or listen to them at a later time. This was one of the interviews from the Tennessee Commission on Children and Youth, and this was from their Facebook post, so that was great. And they still have that interview and will be reusing it each year. So if anything needs to be updated at any point in time, I can definitely do another interview, but for now, this one is going to see us through for several years, I think. And next slide. Here was our proclamation from our mayor. We had him sign a proclamation in 2024, 2025, and he has already issued a proclamation for 2026, which is exciting. And next slide. Here was our proclamation from the governor. We had tried really hard to get a proclamation in 2024, and we just weren't able to secure it. But with our help from the Tennessee Commission of Youth and Children, we were able to get the proclamation signed last year by the governor, and we're working on it again for this year. And next slide. So this again is one of the projects I'm most excited about. There is a SVU detective in Nashville who has worked um, on, sex abuse, physical abuse cases, child maltreatment cases for years. And he still, after all of that time, is still very passionate about education and prevention. So our hospital pulled up the Kosair and FACEit cards that they have in regards to the 10-4-FACEsp education, and our marketing people made up our own little cards. And so what we're doing is on October 4th, and then also again in April for Child Abuse Awareness Month, all of the police department in Nashville, all of the Metro Police Department, all of their officers get one of these cards, and when they come in the morning, they have a briefing with the whole department, and during that briefing, they get a small lecture that I've helped prepare on 10-4-FACEsp. They get a brochure, and then they get these wallet-sized cards to put in their wallets and carry with them. So twice a year, the entire Nashville Police Department is getting a condensed education, but education nonetheless about 10-4-FACEsp. And this year we are trying to reach out and get this done here in Memphis, which is where I'm located. Le Bonheur Marketing has put me in contact with the chief of police here for the Memphis Police Department. And so we're trying to instill this program here in Memphis where everyone in the police department will again get education on October 4th and then again in April for Child Abuse Awareness Month. And my hope is that we will continue to spread this throughout the state of Tennessee to even more jurisdictions and additional police departments, sheriff's departments, law enforcement, that sort of thing. Yes, Miss Goins, you have a question?
I do, and you may have said this and I may have missed it. And sorry if my internet is glitching. I'm getting signals that it is. Who pays for the cards?
So it kind of depends. Le Bonheur Marketing has actually paid for most of the cards. There have been a couple of times where was a little glitch here or there, and I paid for them out of my department's money. But as a general rule, our hospital's marketing has received permission to consider this part of their outreach and part of their community education. So they pay for the cards, and then I pay for the shipping to Nashville, and then I get reimbursed. So yeah, great question. And then the pamphlets that I made, I just email them to the police department and they print them out themselves. So I don't really, that doesn't cost me any money at all. I just created the pamphlets and then send them on. The wallet cards, that does cost money because you have to have a special printer to be able to print the small cards. But yes, that's how that works. And next slide. Sure. So this is just a slide of the brochure that has pictures explaining each of the injuries and what you should be looking for. So this is part of the education that the police department receives in April and then again on October 4th. Next slide. So in 2026, this year, we are working on our 10-4 conference for this year. We didn't have a 10-4-day conference last year because I was on maternity leave, but our plan is to have this be an annual thing from now on. We're continuing to work with the Nashville Police Department. As I said, I'm trying to expand this project into the Memphis Police Department, and we have already obtained additional proclamations, again, from the Memphis City Mayor, from the Collierville City Mayor, Millington City Mayor, Germantown City Mayor. So those are all suburbs here in Memphis. And I've reached out and have at least 10 other proclamation requests waiting to either be fulfilled or not be fulfilled in surrounding areas, counties, and separate jurisdictions here in the Memphis area. So that's all really exciting, and we hope to just continue the good work and the good fight and continue to get the education out there about this wonderful project.
Thank you so much, Dr. Wade. And it's really exciting, all the great work that you're doing out there. Are there any questions from anyone, either about anything in Dr. Wade's presentation or anything that we've talked about at all today? Anything else in the chat?
I have a question. I was wondering, how do you communicate this project to parents specifically, um, especially in a way where they don't um, feel kind of on edge or defensive about um, this type of information? We have at the Cabbage Patch, we have a monthly meeting with parents, and I'm wondering how to incorporate this into that meeting.
And I can talk about how I broach the subject with parents if that is okay. I don't want to interrupt
Yeah.
Ms. Downs or anyone.
Oh, sure. Go ahead, and then I can hop in after you too.
Okay. Whenever I'm talking to parents about this, I do stress this is not a diagnostic tool. This does not mean that if you see one of these injuries, it is necessarily abuse. It just means that the child needs to have further medical evaluation because there are plenty of medical diseases that could cause a child to have some of these injuries when it not be abusive trauma. So there could be a bleeding disorder like hemophilia, von Willebrand's disease. There could be something as scary as leukemia that's going to cause a child to bleed or bruise easily. So we need medical evaluations and appropriate medical evaluations when a child has these injuries because we need to be able to determine, is this something that happened from an accident? Is this something that happened because the child has a medical condition that predisposes them to injury? And you don't ever want to miss something like leukemia, or hemophilia. Those are serious medical conditions that you don't want to miss or ignore. And then also, I stress the fact that it's my job not only to make sure your child is healthy, but to make sure your child is safe. And so parents, I think, usually understand that when you broach the subject in that way. I always say I'm not accusing anyone of anything because I'm not. That's not my job to accuse someone of something. My job is to perform a medical evaluation on a child, make sure the child is as healthy as they can be and also as safe as they can be.
Yeah, and the only thing that I would add to that is we talk a lot about, like with our partners, we talk a lot about just supporting parents and caregivers and kind of creating that environment where people do feel comfortable about kind of talking openly about the things that they are struggling with and kind of not always having, an immediate knee-jerk response, I guess, to reporting or like even like threatening to report if somebody says, that they're struggling or stressed out or so we really try to, encourage that and kind of talk about that. And then also I think just framing it as, this is information that we want people to have so that they feel equipped to take action if they do see something that could be potentially concerning. So it's almost like giving them the tools, the tips, the strategies to support other family members that they have, friends, parents that are kind of in their circles, what they need to know to support them, but then also to be able to like keep kids safe and know what to do if they see something that could be potentially abusive. So it's not like I think this is what you could be doing or at risk of doing. It's let's make sure that we're all equipped because we all have a role to play in keeping kids safe.
Right. Yeah. Thank you, Dr. Wade. Thank you, Courtney. I
Yeah,
definitely appreciate how you guys framed that.
great. It's a great question. Thank you. Is there questions from anybody else?
I'd also like to add that in the toolkit, although it's not a direct hey parents, here's what the 10-4-FACESp Bruising Rule. We have added some content that we also share on our socials around crying, because crying is a big stressor for parents. And I think what's the other one? I made it, so I added it. I just forgot what it was, but I'm pretty sure. Oh, it's ways to connect, and the importance of being connected, and it can be overwhelming and stressful. And so we have added some messaging in there to approach it from that angle. So it's more like, yes, crying is frustrating, and it's because of this, but it is okay to leave your baby in a clean, safe crib, safe space, and take a step away for a moment. So there's some language in there that could be helpful if you are interested in that.
Yeah, I think I'll get some more materials from you guys and distribute it. Thank you.
Yeah. Great. All right, so we are going to wrap up and, just some easy ways to take action. You can attend one of the trainings, one of the 10-4 trainings that we have coming up. Like I said, Tuesday, October 6th or Thursday, October 8th. Securing a proclamation. This is something that we do every year, and we try to expand to as many counties and cities as we can. And just as a reminder for folks, like a proclamation, it does more than just mark a date on a calendar. It really does show that preventing child abuse is a community priority. It encourages media coverage, and it promotes public conversations that may not be happening otherwise. So it's really great if we can get as many of those as possible. And then, as Clarissa talked about, spreading the word on social media and in the news. We have the social media toolkit as well as other resources and videos on FACEIT's website with hashtag. And you can share our posts, you can share partner posts. So, if you're new to this, just pick one thing that you can do to get involved. And thank you all so much for joining us today and for all of the questions, and Dr. Wade for sharing all of the incredible work that you're doing. And we will send a follow-up email and also just follow up with folks who maybe left some comments in the chat as well. But I appreciate you all being here with us today.